Lower eyelids are outward after eye bags removed. Do I need a revision in 2 months? What can I do in the meantime? I had under eye bags removed a month ago. The doctor cut some excessive skin off. Now my lower eyelids are outward. My eyes are very dry. I look very scary when head is down. My left eye is worse. Doctors said they will get better, but I am skeptical. It has been a month, but lately I don't see any improvement. I don't know what I can do to make them heal better and faster.
Thank you for your question. You submitted a photo and you describe in your question that you underwent eye bag surgery about a month ago and that you are dealing with a problem with the eyelid being everted or turning away, and that you're asking about revision surgery, about timing, and that your doctor said that explained that it would get better. So certainly it's understandable why you're distressed. Just to give you a little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon. The oculoplastic surgery background means that I first trained in eye surgery before training in cosmetic and reconstructive surgery of the eyes, and which makes me a super specialist. And for over the past 20 years, my focus and practice has been cosmetic, and I treat people from around the world for conditions that look like yours. So I think I can give you some guidance as to my thoughts on what you can anticipate and what options you may want to pursue. To begin with, the procedure that you had undergone was called a transcutaneous blepharoplasty, which means that your doctor went through the skin through an incision underneath the eyelashes, and then to address the fat pockets, and then to help address maybe some wrinkles or excess skin, took away skin. Now that resulted in a relative skin shortage, which causes this eversion called ectropion. Now what that means is there is technically a relative skin shortage, and it's affecting both your eyes. This is a common complaint in a lot of patients who have this external approach. But in addition to that, very often there's also a loss of muscular tone that is usually temporary, that could contribute partially to the degree of this eversion. What that means is that as time goes on, it usually does get a little bit better. But my main concern always is about the health of the eyes. When the eyelid is everted, the tear film that lubricates the eyes can be compromised. The internal part of the eyelid, which is very delicate and is meant to go against the eyeball, is now exposed to the external environment. So management by an eye doctor, an ophthalmologist, or through your doctor who performed the surgery is important for proper lubrication and observation to avoid infection. In terms of timing of surgery, well, this gets a little bit challenging. When people come to me with similar conditions, as long as there's no urgent need to intervene, and there have been cases where that's a situation where someone's eyelid was so pulled down and retracted and their eyes were constantly watering and they were developing compromise of the cornea, including abrasions and ulcerations, I had to move faster. Or their eyelids were not aligned and I had to revise their surgery sooner rather than later. But when there is the luxury of some time, it is better to wait to allow for resolution of swelling. Now I feel that there is still a sweet spot when there isn't too much scar tissue that I like to go in and do something to help the patient. The challenge for you is also about the shape of the lower eyelid beyond getting the eyelid back into position. It is not uncommon for a situation like yours to result in a rounding of the lower eyelid. Now, although that might be an acceptable aesthetic appearance, for a lot of patients, it's also a challenge because that rounding affects the function of the lower eyelid. And many times people feel like they've lost the character of their eyes when they see their eyelids rounded like that. So there may need to be more than one procedure, and there may need to be more than one time to do those procedures. So understanding that, I think that if you feel comfortable with your doctor and your doctor is guiding you and is monitoring your situation, that you still have some room to wait. And if there is any issue about the health of your eyes, then seeing an ophthalmologist is very, very important. So understand that this type of situation can be managed, can be improved, but it just seems that at the 1 month point, with the appearance of your eyes the way they are, that you will need revision surgery. The question is what kind of revision surgery? Just to give you an example, when you think of lower eyelid structure, there are three key elements. There's the tendon that holds the eyelid, there's the support structures on the inside, and then there's the skin on the outside. And all of that can be affected by cosmetic surgery. But when we have to do revision surgery, you have to address pretty much all those elements. Sometimes you can do more or less of any one, but those three elements or aspects of lower eyelid position need to be addressed to get an optimal result. A lot of times patients have come to us after multiple operations where the doctor kept on pulling the skin, pulling, trying to treat it like a facelift, and the eyelid kept on rolling down, down, and down, and kept on becoming worse and worse. So understanding that there are some very critical anatomic elements to get not only a good looking lower eyelid, but a good functioning lower eyelid is something that hopefully you and your doctor can communicate about so that you get the right procedure and get the best result possible. So I hope that was helpful. I wish you the best of luck, and thank you for your question.